Hi, I'm Jill Lally, and I'd like to welcome you to the Natural Way to Better Health and Wellness. We have Dr. Donald DeFabio with us, distinguished chiropractic physician, who's going to shed some new light on the Pagano Approach for psoriasis. Thank you, Dr. DeFabio.
Oh, thanks for having me here, Jill. I'm really looking forward to sharing some really wonderful information that's been around a long time, but it really has some cutting-edge properties to it, too.
Doctor, what is psoriasis?
That's a good place to start. Psoriasis is an inflammatory reaction of the skin. It's considered an autoimmune disease where the skin gets red, patchy, irritated, lots of dry scales. There's several different forms of psoriasis, and it affects approximately 1 to 3% of the American population.
What is your background and interest in psoriasis, doctor?
You know, it's very interesting because I was never looking to go out and research psoriasis and how chiropractic methods can help psoriasis, just like Dr. Pagano was never looking for it. He stumbled upon it when he was a chiropractic intern at the Spears Clinic many years ago, and over the years he developed natural means to help psoriasis patients improve naturally. And I developed a relationship with him professionally, and he was from New Jersey, so I'd send all my psoriasis patients to him for over 30 years. Unfortunately, when he passed away, there was no one to carry on his tradition, and that's kind of how I fell into it. Since he's not around, I'm carrying on his tradition, and I'd like to give a quick shout out to his family and to him, because very rarely are there people whose life will make an impact after they're gone. And his contribution to the natural management of people with psoriasis and helping them regain their health is really something that's going to live on for generations past his life, and it's really an honor that I've stumbled onto carrying that on.
Well, in fact, the Pagano organization has recognized you on their website, psoriasis-healing.com, as the physician to carry on the revolutionary work of Dr. Pagano.
And again, Jill, I wasn't looking for that, just like he wasn't looking for that. So our life paths have kind of followed a similar trail. But again, I knew about his work when I was an intern in chiropractic school, and it's been successful for many years. I've been in practice for 31 years now, so it's just great to have a resource where we can take natural healing methods and help people that are suffering from something that can be disfiguring and disabling. And it's just nice to see that there's an option. It's really important that people understand that the psoriatic patient get an accurate diagnosis from their dermatologist. I make sure everybody needs to know that. Get an accurate diagnosis. Once they get an accurate diagnosis, find out what the medical community wants to offer you. And there are some very good medications today. And there are procedures that have been around a long time that are still effective. But the bottom line is, if you want to do it, great. If you want to look for something alternative, or if you tried those things and they didn't work for you, or the side effects weren't what you wanted, then you have something to turn to, and that's where the Pagano program comes in.
And I know some of those case studies that he has done and you have done are very powerful.
Yeah, it's very powerful, powerful. In fact, the last time I was in this studio speaking psoriasis was with Dr. Pagano, and I was interviewing him, one of the highlights of my career. And it was really, really empowering. And if that's possible, Jill, and if you don't mind, I'd like to show a little clip from that show about his case studies, and specifically how his program will help people with psoriasis. So if that's okay, I'd like to show that little clip from a previous interview.
Thank you, doctor.
Tell me about some of your success cases.
Well, this one particular case was very dramatic. A young girl, 14 years of age, and you can see from her back she had pretty massive psoriasis.
Yeah.
Had it for 5 years.
Wow.
And her mother would tell me that she would just sit up on her bed upstairs and cry all day long because nothing was working. Mm-hmm. They brought it to me. We went over everything. I completely went over her case history of what she was eating, and in particular, she was eating too much macaroni and cheese. Every day she would have it. And that's
Okay.
all carbohydrates and fats. See?
Okay.
When I put her on the diet, I gave her the treatment, the spinal adjustments, and showed her how to apply the oils, sent her home. She came back in 2 months with a result like this.
Wow.
Practically nothing
Wow,
left.
that's fabulous. So a common treatment time for an adult would also be 2 months, or do kids have a tendency to respond a little quicker?
Well, the kids respond quicker,
Yeah.
no question about it. But adults can too.
Well, you have any adult cases to share?
Yes, for instance, here's a woman who has it on her lower legs.
Okay.
I mean, about as severe as you'll get it.
It's pretty bad.
Very bad. And her husband was the hero, though. He did the massaging of the legs the way I told him.
Okay.
But the diet is still the key. Without the diet, I cannot get results. No one can. So the combination of the two, she went from this severe state to this complete
Wow.
healing in 6 months.
6 months. So a little
And
bit longer, but still that's
one
reasonable.
question. She had it before she got to me for 42 years.
Oh my gosh.
42
and results
years.
in 6 months.
6 months.
That's terrific.
She was just thrilled.
Terrific.
You can imagine.
Come on, throw one more at me. You got one more to throw at me?
Well, yeah, there's nothing like healing kids,
yes,
children.
Sure.
Not only because you heal them, but because you save them from a life of misery and untold expense and constantly going from one drug to another. Now, this little girl had it for a period of 3 years.
Okay.
And we got her on the regimen. She came in for her adjustments regularly. The diet, she followed every time, made sure she followed the diet, and she went from here to complete healing
Wow.
in
Look at that.
3 months.
That's fantastic.
3 months.
That's great.
And the thing is, I never have to see them again.
Yeah.
Once I heal a patient, it's amazing, Don. I'm once in a while, once
Yeah.
a year,
As long as they
somebody
stick
might
with
call.
their diet.
They know. They
Yeah.
know what it's all
They know
about.
it too.
And the big thing is they lose the fear of it.
Got
They
it.
lose the fear.
Well, it empowers them to take charge of their health.
Dr. DeFabio, that was fantastic. Wow.
Pretty empowering, isn't
Yes.
it? Yeah.
So when we come back on our next segment, would you please discuss your findings on the current research regarding the Pagano approach that documents the evidence of what he had developed?
Sure, that's great, Jill. We can really see the parallels between old school and new technology.
Thank you. I'm Jill Lally with Dr. Donald DeFabio. We'll be right back.
It's not just like a doctor that gives you a pill. It's a doctor that helps you work with your own body so that your body can be the best it can possibly be and as pain-free and healthy as possible.
I think a lot of people think that they need to live with pain, and it's normal to live with pain. But I see it in my business that it's not.
Research has shown that when you've had an injury, you will get better faster with activity versus complete rest. So my job is to give you a list of what your do's and don'ts are on your first visit. And then we keep modifying that, adding more do's, getting less don'ts, until you're completely rehabbed and better and doing all the things you want to do.
With my running, I was a marathon runner and I had chronic sciatica. Chiropractic was the only thing that really alleviated that pain for me.
Dr. DeFabio was able to help me regain a quality of life that I didn't think that I would be able to find again after the accident.
My objective is to know what's wrong, figure out an accurate diagnosis, and get the treatment protocols that are going to get you better as quick as possible. It's a full body approach, and that's what chiropractic is all about, is looking at the whole body and enabling the body to heal better, quicker, and naturally, without medication, without drugs, in a holistic, natural paradigm. That's the reason that I think people choose to come here.
It wasn't just come in, let's treat it and send you on your way. It's, okay, why did this happen? How can we prevent it from happening again?
And I want to make sure every visit feels special on the way in and on the way out.
He doesn't make you feel like you're a number. He makes you feel like you're an individual, almost as if you're a family member, and he wants to make sure that you're as satisfied with the results as you can be.
It's just a very welcoming place. You're treated well. You're treated with a lot of caring.
Because of the services that he provides and how considerate and compassionate he is, to come to Dr. DeFabio wasn't even a question.
Hi, I'm Jill Lally, and I'd like to welcome you back to the natural way to better health and wellness. I'm here with Dr. Donald DeFabio, distinguished chiropractic physician, who will now discuss some of the current research findings that support the Pagano approach for psoriasis healing. Dr. DeFabio?
Well, thank you. Jill, one of the things that Dr. Pagano talks about, and again, anybody with psoriasis that's interested in what we're talking about today, just get his book. Go to Amazon. Healing Psoriasis, John Pagano. It's been a bestseller on Amazon for years. It's all in there. One of the things he talks about is a failure of the intestines to work properly. The intestinal lining gets kind of worn out. It's supposed to be lots of bumpy linings, and it gets worn out, and he called it a leaky gut syndrome. And that lining then allows toxins to enter into the body, and then the toxins get manifested in the skin as the inflamed, red, itchy skin as they're looking for a way to get out. And there's lots of things we found out. He would talk about using diet to heal the gut and the lining. And he would talk about lifestyle changes to heal the gut and the lining, to eliminate those toxins. So current research has found some very interesting things. One that I thought was really interesting, patients with bariatric surgery, meaning they had their stomach cut out for weight loss, who happen to have psoriasis, their skin cleared up almost immediately before any weight loss occurred. Now, the segment of the intestines that Dr. Pagano in this very studio talked about was the problem was the jejunum, which is the transition between the stomach and the small intestine. So that could very well be taken out when they take out the stomach. So I thought that was really cool. And that research was from 2015, just came out. However, we also know that there's a relationship between inflammation and psoriasis today. They talk about things called cytokines, interleukin 1, interleukin 17. These are these pro-inflammatory chemicals that circulate around in your body, and they can attach anywhere and create a problem. We know through current research that those interleukins, those cytokines, are prevalent in the psoriatic population and in the skin. But we also know we can suppress those with diet. There's a lot of research showing that diet and inflammation go hand in hand. In fact, another article that just came out in 2015 talked about, it's called nutrition, a key environmental and dietary factor in the clinical severity of cardiometabolic risk factors in male psoriatic patients. That was the title. It just came out in 2015. The bottom line was low MUFAs, monounsaturated fatty acids, were found in psoriatic patients. And high concentrations of saturated fatty acids were found. What does that mean? Saturated fatty acids are found in grains, and are found in fried foods, and are found in processed foods. They drive inflammation. Polyunsaturated fatty acids are found in greens, green leafy vegetables, fish oil. They suppress inflammation, and we know that today. Biochemically, we know that. What did Dr. Pagano recommend? Stop the white flour. Stop the refined carbohydrates. No white sugar. No fried foods at all, right? Eat lots of green leafy vegetables. 80% of your diet should be what he called alkaline, which is above ground vegetation. Meats, chicken, fish, lamb once to twice a week. Why lamb? Lamb eats grass. Grass is anti-inflammatory. So all the things he talked about are actually being documented in current research. And I think that's really, really cool.
Well, I know that Hippocrates, the father of modern medicine, said all disease begins in the gut. So here we have Hippocrates and Dr. Pagano now believing and having an approach of what is now recognized in current research studies and literature.
And I'm going to talk a little bit more about that, Jill, because leaky gut, the concept is that the cells of the gut are supposed to be real tight, and they open up and it gets leaky and things can go through that aren't supposed to go through. But now we know that some of those chemicals go straight through the cells when they're not healthy. So the barrier might be not leaky, but the cells themselves might actually leak toxins and irritants. And how do you get that to heal? You got to get rid of the irritating factors, and then you got to promote a healthy intestinal environment. The big name for it is dysbiosis, gut dysbiosis, okay? The healthy environment of the gut. And that's with food, nutritional supplementations, stress management, okay? Healthy mental attitudes important. And then there are medicinal teas and herbs and things he's talked about that you can take as well. But all these things are coming full circle. So what he had researched from Edgar Cayce's work, which is probably going close to 70, 80 years now, we're keeping the baby. And the bathwater turned out to be pretty good with these guys. So what they were saying is being clinically documented in modern research, and that's neat.
And so our viewers understand that leaky gut syndrome can also be termed intestinal hyperpermeability. Yeah. So you may hear that in the medical community, people talking about leaky gut, yeah. And it's really...
Yeah, so I guess we didn't talk about it too much, but basically what happens is you ingest foods or other things, and either they don't get broken down properly, or they get absorbed too rapidly. But the bottom line is toxins, irritants get into the body, and it creates an antigen-antibody reaction. Basically, the body starts to react against things which normally shouldn't bother it, unless you have a food or chemical allergy. And then it gets manifested in disease, and in psoriasis, it comes out in the skin. But there's lots of other autoimmune diseases that work this way. So again, the research is there, it's just where we're going to branch it out onto.
So Dr. DeFabio, when we return, will you talk about the diet highlights and also your integrative approach that you are now doing beyond the Pagano approach?
Well, it's just taking current research on what Dr. Pagano had developed through the Edgar Cayce research. It's just bringing it to the next level, and that'll be great. I look forward to that.
When we return, we'll talk more about the integrative approach on the Pagano psoriasis healing. I'm Jill Lally. Thank you.
Of my people come in because they have pain, because they can't do something. They can't go to work, they can't play sports, they can't take care of their kids. There's something they can't do. They come in, we give them a short series of visits, and they get back to their everyday activities. I call it returning back to function.
After I had my first baby and couldn't move my head and my neck was really stiff, and one of the fitness instructors at the Y, whose class I took, came here, and she really loved it here. I've been coming ever since.
When I came to Dr. DeFabio, one of the things he was able to do was to take the time to understand my problem, explain to me what was actually happening with the body, and together we developed a plan to find success in the treatment. So I was able to really gain a quality of life back that I wasn't sure that I could ever have again.
There's a whole aspect of chiropractic that's about health and wellness and a lifestyle. That's a lifestyle choice. Those are the people that choose to commit for periodic adjustments to help maintain the quality of their life and to stay active.
I made a commitment to myself to take care of myself because it makes me a better mom and a better wife, and it makes every part of my life better. It's not really about, coming in with an injury or something to fix. It's more about taking care of yourself from head to toe, thinking about what you eat and thinking about how you exercise and how you stretch and how it all plays into feeling good.
There's 5 factors to a wellness lifestyle: getting enough sleep, exercise, a healthy mental attitude, eating the right foods, the appropriate diet, and perhaps nutritional supplements, and a healthy nervous system. And you have 2 choices. You can choose to embrace it and do everything you can to enhance it, or you can choose to do nothing. So incorporating those 5 factors of health will create a wellness lifestyle.
Welcome back to our show. I'm Jill Lally with Dr. Donald DeFabio, talking about the Pagano Approach to Psoriasis Healing. Doctor, can you give us some diet highlights?
It's pretty straightforward, really. Dr. Pagano talks about, as I mentioned previously, no fried foods, no white sugar, no white flour. All right. In fact, sometimes he'll take people off all grains for a month. And again, current research has shown a relationship between a gluten-free diet and reducing psoriasis, and they don't know why. Why? Because grains are high in omega-6 fatty acids that drive inflammation. So I digress a little bit, Joe. And then he talks about keeping people away from nightshades, tobacco, white potatoes, actually all potatoes except for sweet potatoes, which are actually a yam or tuber. Peppers, eggplant, tomatoes, I think I already said. So no nightshades. He's very adamant about that. Alcohol, no alcohol, okay? And low fat, all right? He doesn't want saturated fat. He wants those polyunsaturated fats. And that can be a little daunting for people, and that's why he wrote his cookbook, okay? Dr. John's Healing Psoriasis Cookbook. So if somebody has a problem with, well, what do I eat? Just get the cookbook, okay? And you can have the lemon braised chicken any time of day, breakfast, lunch, dinner. So it's great. Again, that's on his website, healing-psoriasis.com. And those are the resources, and that's it in a nutshell. It's 80% alkaline foods and only 20% acidic foods. Now, for some people, what does that mean? Well, it means get your pH tested. We can test that now. And it's real simple. You just use a little bit of pH paper. All right? You wet this with your saliva, and then you put it up against a little sliding scale. It tells you whether you're acid or alkaline. This is one of the things we do in the office to help our patients stay alkaline. All right? Red beef, red meat, it's acidic. That's why it doesn't have people on it. All right? So it all ties together. But that's a synopsis of it. Lots of water. 6 to 8 ounces of water a day, preferably mineral water. Why? Alkaline.
And then you had mentioned during the break about an apple fast?
Yeah, in the beginning of the program, he talks about it, a 3-day apple fast.
Okay.
Red delicious or golden apples for 3 days, and preferably taking a high colonic with that. Okay. Colonics clean out the colon. You want to clean out the colon because the liver, another organ of detoxification, dumps into the colon. So if we're using agents to get the liver to work better, to dump toxins into the colon, let's make sure the colon's working, otherwise they just get reabsorbed. If you can't do the high colonic, an enema would be fine, okay? But that's the 3-day apple fast, works well to jumpstart the program.
So you're addressing digestion and absorption.
And elimination,
and
all
elimination.
3. You gotta get people eliminating. A little bit of exercise so they sweat is okay.
Right.
That's important. They gotta get the kidneys working well to eliminate that way. You gotta get the liver dumping the toxins into the colon, and they gotta be pooping, okay? And that's where some of the medicinal teas and herbs and things that Dr. Pagano recommends come on track. And sometimes when you drive all these toxins out, people get flare-ups. You just need to be patient. It's called a Herxheimer reaction. Just need to be patient. It will calm down. But we also know that high doses of pancreatic enzymes, which is a supplement, help suppress that now. So there are ways to manipulate some of the things that Dr. Pagano was working with all these years.
So are these some of the approaches that you incorporate into your...
I follow Dr. Pagano's program. I tell everybody, first get the book, read it, start there. And then from there, we make sure they're doing their slippery elm tea in the morning and their American saffron in the afternoon. They help heal the gut. The slippery elm's a coating. The American saffron, he calls it an intestinal antiseptic, but it keeps things moving and it helps fight off candida and other parasites and microorganisms in the gut. But we also know that ginger, turmeric, boswellia, great anti-inflammatories for that cytokine, that inflammatory cascade. We also know that your omega-3 fatty acids need to be purified now, otherwise it creates inflammation. And we can get a really highly concentrated, refined omega-3 fatty acids to jumpstart that inflammation from being suppressed. So there's lots of things we can do nutraceutically. We can get on-the-go powdered meal replacements that offer decrease in inflammation, healing of the gut, and cleansing of the liver and with protein. And people can use that as a meal replacement. So there's lots of things we can do to augment what Dr. Pagano started so people can live their life and get through the disease. But, you know, I am a chiropractic doctor. It's all revolved around a chiropractic lifestyle. I don't treat psoriasis. Dr. Pagano didn't treat psoriasis. We help people who suffer with psoriasis to get their life back using natural means that we were trained in.
And you do use chiropractic spinal manipulation.
That's the treatment we provide, is chiropractic spinal manipulation. Exactly, because we know it's called the Merrick system of spinal adjusting is what Dr. Pagano used. Certain nerves from certain levels of the spine go to certain body parts. We want to make sure the nerves go into the pancreas because carbohydrates and too much sugar in the diet is a problem. So you want to make sure the nerves go into the pancreas work. The nerves go into the colon work. The nerves go into the liver work. So we would adjust those segments. If the nerve flow to those organs work better, then those organs work better. Then you take away the irritants, take away the aggravating factors, and what he used to say, it's what you don't eat will make you well. And that's how it works. So we're enabling the body to work better and heal on its own.
It sounds like a healthy gut and a healthy spine will give you healthy skin.
Yeah, I love it, and I think you would too.
Thank you, Dr. DeFabio. I'm Jill Lally, and I appreciate you tuning in to the natural way to better health and wellness.